That was actually a question I had from someone. As a holistic dentist, do you use a different kind of anaesthetic to the general orthodox approach? Is it less toxic or is it less harmful on the body?
Great question. And I guess the ultimate answer is, if you are already in a state of trust with your dentist and the procedure is not extreme, like taking a tooth out or root canal treatment or something very deep, I'll put it to most patients that if you trusted your dentist enough and they were highly skilled, used very modern instruments, brand new tips for each patient so they're as sharp as they can be. In my world, 80% of my dentistry is done without anaesthetic, but we've got good control mechanisms in place, so my patients always feel in control, so they have their hand on the brake, which is basically a left hand in the air means get out of my mouth. So when patients already have that sense of control, it's amazing how much of the neurological stress and the fear of the unknown in dentistry is dissipated. And in my world, 80% of my dentistry is done without local anaesthetic. But if you're doing extreme surgical dentistry, then yes, we use anaesthetics for sure. If we're not using general anaesthetics, we'd rather be using local anaesthetics, I think, wherever possible. On my website, I have a download for a relaxation hypnosis program, where I've trained my patients to be able to teach themselves self-hypnosis and even somnambulistic hypnosis, where they can go into an altered state where they don't actually have to have any anaesthetic as well. That's with deep meditation. So you can train your mind, as we all know, to incredible pain control if you want to be extreme. I'm not suggesting that for the masses, for sure. Even if just the edge was taken off by a relaxation program, I think that would be helpful. But if we are using local anaesthetic, we'll use a topical gel first. Just like the Emler plasters that everyone's having now when they're having intravenous drips put in and things. You have a little plaster with a topical gel that numbs so you don't actually feel the needle go in. I would say the majority of the fear and phobia is of the needle. So if you can just get that needle in a calm person beforehand, numb surface, gentle technique. There's an amazing technique, which is a computerized technique, which I personally don't have in my practice, called the wand. That's in my hands. I feel I can deliver local anaesthetic incredibly comfortably. But if someone's maybe not so gentle, you can have a machine that titrates the local anaesthetic at such a slow, gentle level that you won't feel the liquid entering into your system. The anaesthetics. Good question about whether you use epinephrine. I think I had one of your patients ask whether we use adrenaline in our anaesthetics. The main benefit of adrenaline is it causes a vasoconstriction, or the capillaries to contract. That has the benefit that the anaesthetic will stay in the vicinity of placement for longer. It won't wash away quickly. So maybe an hour's procedure will only need the one anaesthetic. If it's not used, the procedure will probably need to be re-administered after about half an hour sometimes. It depends on the extremity of the procedure and also how quickly someone's metabolising. Because some people metabolize their anaesthetics a lot quicker than others.
And I may be wrong, but sort of coming from a more holistic perspective as I do, and I believe a lot of health issues come from stress.
Sure.
Obviously, adding in that adrenaline is just increasing stress. So as long as
it's like a coffee, it's like a strong coffee.
As long as your other stresses are down, so
Yeah.
you're eating right, you're sleeping well, this and the
Yeah.
other, then that little bit of adrenaline shouldn't really cause you too many issues.
No.
If you need it. It's if your stresses are up here,
Very
and
much
then
so.
you're giving the body another shot of adrenaline, and even then it's not really going to be drastic.
It's a short-term thing. It does
Yeah.
create some panic. The main one is when you have to have a procedure on your lower jaw, because this bone is so dense. We have to block the nerve. So if we've had dentistry on our lower jaw, we'll know that we have this very paralysed half face, sort of hemi-paralysis almost, for about an hour to 2 hours. I have a golden rule that I'll never use an adrenaline product for the lower jaw, because there's a risk that you can actually get it into the vascular system.
Right.
If it just goes into the space around the vascular system, then it just absorbs in and will numb the lingual nerve and inferior alveolar nerve, and will give you good anaesthesia of your tongue and of the kind of cheek and lip. But if you go mainline into that can cause some severe cardiac arrhythmias and panic attacks. And there's many people have had that, and they remember it so well, and that's put them off going to the dentist as well, because it's quite an extreme experience, and often causes the patient to abort treatment because it's such an extreme experience. They don't want to have the dentistry after that.
I think maybe from a more sort of holistic point of view, that may also be what people suffer, but from a more internal perspective, for instance, if someone has an adjustment that is too forceful, for the position that they're in.
Especially a neck one.
Because the amount of times I've had clients come to me who have said, I don't like being adjusted. And I'm like, okay, fair enough. And the same techniques you use. Why is that? What's the reason for that? And quite often you'll find that they saw someone before. And I often find this with hypermobile clients. Because one of the things is when the joint's very mobile, the ligaments are very mobile, it's very hard to get an adjustment because of the movement of the joints around the locked joint. And what you'll often find is that clients have experienced therapists maybe trying a bit too hard to get that release, when I actually find that if you back off and you almost create more of a compression in the joint and a very gentle adjustment, you get that release. And I've often found that by being more gentle, or even maybe not manipulating for the first couple of sessions and just stretching, they open up to it. And I find all clients, and I'm sure you find that with your clients, they open up and go, yeah, actually, I know you're not going to hurt me, so go ahead. And it's that level of trust, which is fantastic. And for any therapist who gets trust from their client, it's the biggest thing, because it's a great compliment, not just to yourself, but to your patient-practitioner relationship. And I think with a dentist, it's probably heightened even more than for someone like myself.
Well, that goes back to this TLC concept that we were taught at medical school. If you can, you grade your dental care in increasing amounts. Even if someone comes with extreme problems, unless they're in agony, you can palliate a lot of the signs of chronic disease in the mouth without extreme dentistry. And then you build up to more complex dentistry, so that you're winning trust, you're getting the vibe from the patient, like, oh, he's nice or she's nice, they care. And by layering your techniques, you then, when you have to be a little bit more assertive with your clinical situation, they're more ready for you. And I think that's got to be the secret to learning a language, learning music. If you give someone extreme from day one, it puts them off. And if you can find a way of holding someone's hand. So sadly, when someone's in agony, you've got someone's going with more extreme care. But thankfully, most of the time, we can progress through and avoid that. So going back, I've got to share a couple of techniques, because anybody watching can teach this to anybody that they know that is nervous of anything in life, but especially with the dentist. And we go through this with our patients. There was a Reiki technique I was taught, where if you hold your hand in your two hands in two different places in a clockwise manner, you set up this positive energy field that has a kind of soporific calming effect on you.
Almost like a Qigong.
It is a Qigong kind of concept. I was taught by a Reiki teacher, but it could be a Qigong concept. I'm not sure of the out and out origins, but yeah. If I'm assuming it works with all hands, whether you're right or left-handed, but as a right-handed person, I place my right hand on my heart, pointing to the left so that it's going to go in a clockwise manner, and then my left hand on the solar plexus. And then you visualize a circuitry in a clockwise manner going from solar plexus to heart, back to solar plexus. And then you time that with breathing. And you get conscious and aware of your breath. And all my patients that have had either panic attacks in my chair or shown signs of about to have a panic attack, they're usually holding their breath. And we make sure I have my nurse trained, so she's either looking in the eyes or looking at the chest to see if there's movement of the chest in particular, to see if they've held their breath. And if I know they're a nervous patient, I'll teach them breathing techniques, especially the diaphragmatic breath, where they're kind of their hand is rising with the in-breath and then going in with the out-breath. And I get them to breathe out that extra centimetre or two of breath, so that they really are fully exhaling, but more importantly, slowing down the breath.
Putting them in the now, putting them in the present.
In the present.
Rather than focusing on the pain, which is...
And isn't that the magic, how all the people have had incredible procedures done, even committed suicide. Or I remember the Vietnamese Buddhist monk that was burnt alive in the Vietnam War, and he did not move until he was ash, and he just killed over as a lump of ash. He was set alight by his colleagues. He wanted to do it as a protest. He wanted to show to the world that he didn't approve of what was going on in Vietnam at the time. The self-control to get to that point shows it's possible. We're all mortal and we need to learn.
Wouldn't recommend doing it.
Yeah, we all need to learn that for a long time, I'm sure, or under extreme conditions, maybe in a monastery somewhere in the jungles or the mountains. But it's proof that it's possible.
But just getting 5% of that.
Isn't that great?
Would be
exactly
phenomenal to where we're at the moment in Western society.
Yeah, because we're still going to use local anaesthesia. I'm not trying to suggest to people that we have to avoid anaesthetics. I think it's about the patient choosing, And I think choice is one of the key things that I'm passionate about. And I think to me, what's the definition of holistic? It's about listening to your patient, listening and delivering, as long as it's sensible care within the patient's remit of how they want to be treated, but at least being involved in the decision making and involved in the communication of your treatment. I think that's got to be critical, and that's and seeing everybody when they come into you in the here and now, and eliciting what they're presenting with symptom-wise on the day, not what it was a month ago or 2 months ago. If it's been a significant amount of time, we need to check in again and elicit whether what we thought was a good idea 2 months ago is still a good idea.
And I think that's where we're quite similar, because I actually said this to a client the other day where they wanted me to make the decision as to whether they needed to have a surgery on their knee. And you just can't, well, I don't feel I can do that. You know, it's such a big decision for someone that I just went through the many different options they had and said, look, you know, you need to know that you can have surgery. Maybe there's manual therapy or exercise rehab, and we went through the different ones, giving an idea of the length of time it might take for each one. Obviously with the surgery, the level of rehab that would still be required.
Absolutely.
So that's very interesting. I think when we get, you know, if we're looking at the internet these days, people are having access to information, which is fantastic, and I think every client needs to have access. But there is that little danger where people will always see the worst case scenario when it's 9 times out of 10, 99 times out of 100 not the worst case scenario. But I think if you can educate your client with enough information and choices, then it's not passing the buck as such, but it's giving the patient the power to do what they need to do.